a portion of the population that has been totally ignored, totally abandoned, and I feel like I wanted to help them tell their story.
More than 1,000 Canadians have already raised their hands and said, I want my story heard.
You introduced the Vaccine Injury Support Program because people were injured. Any pharma company should be responsible for the products they put out.
For Rebel News, I'm Tamara Ugolini here in Cobourg, Ontario, and I'm joined by Conservative MP Dean Allison, who many of you may know has just recently launched the Allison Inquiry, looking into COVID-19 vaccine injuries here in Canada. You just did your second update on the Hill on Thursday, and so the inquiry itself will launch on Parliament Hill September 8th. It will run 4 days until the 11th. What I heard on Thursday was that there's been roughly 1,000 people apply to the inquiry itself, and you will have roughly 50 people speak over the course of those 4 days.
Canadians will hear directly from vaccine-injured individuals. They will also hear from some individuals who will provide some important context to help us better understand what these Canadians have experienced. Canadians will hear about the Vaccine Injury Support Program, the experience of people that have attempted to navigate it. More than 1,000 Canadians have already raised their hands and said, I want my story heard. We may only have time to hear 50 of them during these hearings, but every one of those 1,000 voices matter.
Just after this update, how has the response been so far?
Well, first of all, thanks for having me on. The response has been overwhelming, right? If you think about it, over 1,000 people have actually applied. That should tell you something about how desperate people are to tell their stories. Think about the fact, too, that not everybody wants, people want to tell their story, but not everyone wants to go through the process of going online, filling out a form. So there's a lot more. You try and make the process easy, but it's still work. And I think, we were finding a number of people still kind of re-traumatized, trying to go through the program and relive their experience. But overall, when you look at 1,000 people plus, that should just tell you the depth and breadth of what's going on out there in terms of injuries.
Yeah, as soon as you said filling out the forms, my flags went up, because what I repeatedly hear from vaccine-injured Canadians is the amount of the bloated bureaucracy involved in trying to get their vaccine injury not only recognized, but just to be able to have it documented somewhere. And so Canada launched the Vaccine Injury Support Program alongside the rushed-to-market interim order that authorized these injections. And that was supposed to, and it promised, timely and fair compensation for anyone who would suffer a rare and debilitating vaccine injury. And what I've heard so far is that that's been anything but. So this bloated bureaucracy and the mountains of paperwork, all of those things just seem to be so triggering, 5 years out for some of these people. How are you mitigating that sort of rehashing of that trauma?
Yeah, and so we have a bunch of volunteers going through that process. Some volunteer doctors, volunteer staff to look at that. There's an original intake form that's very basic, and then they will then give us a little more details on sort of what their injury was, et cetera, and then docs have a chance to look at that. What I've heard in talking to these individuals is that some of that's re-traumatizing, right? You think about the process they've been through, the medical community. Well, they've been basically ostracized, they've been abandoned, they've been gaslit to say, hey, it's in your head, right?
So I sent an open letter to the British Columbia Public Health Officer, Dr. Bonnie Henry, to inform her of these safety signals. Her response was to refer this to her top vaccine safety specialist, Dr. Monica Naus, who assured me without any investigation of any of my patients that these were all coincidences.
And they go to see docs, and we know that because we've been hearing what docs, the brave ones that are willing to talk about it, say is that they've been gaslit by organizations like the College of Physicians and Surgeons. So if you think about it, people go and say to a doc, I have an injury, this is why I think, and all these things. A lot of docs are reluctant to even step out and actually verify that. So, to the doctors that are prepared to do that, good job. We do really appreciate that. But it just shows you how much gaslighting has gone on all across this country at pretty much every level.
Well, and the gaslighting seems to really come from the regulators. I know specifically in Ontario, the CPSO, the College of Physicians and Surgeons of Ontario, put out, like, essentially if your patient is telling you that they have a vaccine injury, you should do a psychological assessment on them and a psych eval. What kind of reassurance perhaps can you offer to whistleblowers that they'll be protected from the shark regulators who are targeting anyone who speaks out against the safe and effective marketing mantra?
Well, I think, and it's not within the purview of the federal government, but I think the provinces should definitely be looking at these associations. I mean, really what they are is they're supposed to be a registry, right? Mm-hmm. The docs, but they've gone far beyond that. And, we talked to some cases. I've got a doc that's going to be coming, Dr. Lutchke, her brother that passed away just within the last month. I had a chance to talk to her, and she said, unbelievably challenging because, she was put under suspension without any charges being brought, no whatever. I mean, Dr. Huff talked about it yesterday about the challenges he's had in terms of people showing up and actually making false accusations, and then you having to try and prove something that you just don't know what you're fighting.
To this day, I have 36 vaccine-injured patients. This is just the COVID vaccines I'm talking about in my practice, and I have a small one-man practice of approximately 1,100 people. The College of Physicians and Surgeons sent a warning letter to every registered doctor, warning them that if they spoke misinformation about COVID or the COVID vaccines, that they would be investigated and, if necessary, disciplined.
You've heard me talk about my other reports on this topic. If you'd like to check them out and support our work on this file, you can do so at nomoreshots.ca. That's nomoreshots.ca.
Now, before we get into more of the nitty-gritty, I've been hearing that this won't actually be broadcast on CPAC. Can you confirm how the 4 days of hearings will be streamed?
Yeah, so there'll be streams in the actual, like, we'll have access to streams at Parliament Hill, and so we're inviting a bunch of independent media up to stream. The Allison Inquiry website will stream, so we're hoping that through a variety of options up there, that'll be able to happen. It's interesting. CPAC's been good with the press conferences. We just had our second update. We announced it, and then we had 2 updates. But they've covered it each time, but we haven't had any confirmation until the morning of, right? We just don't know if they're going to cover it. So it would be nice if they'd cover some of this information, but there's no guarantees that they're going to cover it. But we've access to committee room that will have access to the streaming. We've got the parliamentary precinct that will be our technical, but we're going to have people there and a lot of independents that can tap into that.
Mm-hmm. I think having the live stream capacity of CPAC would reach a lot of ears that perhaps don't know or haven't been reached the last 5 years, because there is a lot of people who are saying, I've heard this stuff over and over and over again. And it seems to the people who have been in this for so many years, it's the same things over and over. The pattern has been quite clear to anyone who's been paying attention to these things. And so breaking through that wall with the use of CPAC and that parliamentary broadcast, I think would be really important. Do you have any feedback from them, why they can't necessarily commit to broadcasting it?
No, but we continue to reach out. Like I said, we reached out to them with every press conference, and as I said, they have not confirmed either way, but they showed up and they've covered it. We're hopeful that they'll be prepared to do the same thing.
They'll do the same. Now, speaking of people who are saying, we've talked about this. We went to the NCI, the National Citizens Inquiry, and that was supposed to be a way to get some of these voices and these stories on the record, so to speak. One gentleman I spoke to in particular, he has been approved through the Allison Inquiry to speak and share his story, and he called me and he said, at this point, what is the point? I've shared my story. I've said everything publicly. There's documentation, there's record. I have to take, 2 days off of work. I have to travel at my own expense. I have to go up in a hotel at my own expense. The re-trauma of reliving this story repeatedly. For people who feel at this point, like, what's the point? What's your message to them?
No, it's a great question. I think, if you asked any politician today what the NCI was, I don't think they could name it, let alone understand what it was. And, politicians, this is not an apologist for, politicians. Politicians are busy doing their own things. They've got 1,000 different things they can be interested in, right? We have everything from national defense and everything in between. So I think if you asked any politician current day, if they understand what the National Citizens Inquiry is, they would probably say, we've never heard of it. So what we're hoping that this will do is actually talk to lawmakers and let them know what's going on in people's lives. And I think if you're in your own little echo chamber, which is, what you're saying, a lot of people, how is it you talk to some people and they say, I don't know anyone that's injured. And then you can talk to somebody else and say, I know dozens of people that are injured. So that does have some of your echo chamber thought process. So it goes back to your point about CPAC. CPAC's important because that gets outside of the echo chambers, right? And hopefully gives people an opportunity to do it. So I just say, what's different this time? I think people have been afraid to talk about this stuff publicly. People have been gaslit. People feel that in fear or treated like, we don't want to hear from you. I think that, my goal is to give people permission.
I think one of the biggest challenges right now is that people have not felt they have permission to actually talk about this.
People need permission to speak publicly about this. And if they can't do that, then the healing can't begin. People are frustrated. People are upset, angry. And they have every right to be so. Right? They were told this was safe and effective. And if you just do this, then you're doing your part. Other people weren't given that choice. They said, you have to take it because if not, you're going to lose your job, or you're not going to get a chance to go to work, or you won't get a chance to travel. So these are all the things. So I think now is a good time to talk about it, is to remind people where some of these people were, and we will always need to talk about these things until we get these problems dealt with.
And I think breaking through that echo chamber, also there's an element there of course, the mainstream media and their coverage of the vaccine, promoting the program, promoting even in some ways the mandates. And you look at that one cover page from the Toronto Star, I think it was 2020 or 2022, where they completely vilified unvaccinated, said we shouldn't tolerate. You had Prime Minister at the time, Justin Trudeau, saying, do we tolerate these people?
If you don't want to get vaccinated, that's your choice. But don't think you can get on a plane or a train beside vaccinated people.
I would say that borders on hate speech, some of the rhetoric and the framing of people who were trying to make an informed choice for their individual health in a time where there was sweeping mandates, massive marketing campaigns that I've reported on as psychological operations to ensure that nothing compromised that safe and effective narrative. You had the Privy Council office putting out their messaging strategies for the media and for the government to likewise ensure nothing compromised that. Will there be any mechanisms, for whistleblowers to come forward and feel safe and feel like they can finally talk about this? Because the framing that we see from the mainstream media, even in some of the questions that they asked you after that update on Thursday.
This is an initiative that you were leading for political motivations, drumming up anti-vaccine sentiment, instead of actually trying to meaningfully have these people's voices heard and make change. What would you say to that?
Even just talking about vaccine injury is inherently anti-vax.
Right, and that's the ultimate irony of this whole situation. Everyone that's coming to talk are not anti-vax, they're all vaccinated, right? So that's a narrative that they push to try and, get silence. And I think, I have to say it again, we have to give people permission to talk about these things. We've got to allow it to become mainstream, that people can chat about this, because how do these people get help if we can never talk about it?
It's been over a year since I lost my intestines. It's been almost a year since I applied to the program. I've still heard nothing. I've received zero support.
Most doctors show up and they don't understand. They don't understand because they can't talk about it. So doctors don't get a chance to figure out protocols and things that may be helpful to help deal with people that have been injured. So docs are who we go to for help, can and won't talk about it. And you've got individuals can and won't talk. Think about people that could even, and I know there's support groups out there, so it's not about trying to find more support groups, but just think about being in your neighborhood or wherever you are and thinking that you're the only person that's suffering with A, B, or C. Wouldn't it be nice to know that somebody else around the corner or even halfway across the country was suffering from the same thing and had some insight on how this could be better? And this is how we have done things forever, right? We talk to people, someone gives you, that's a great idea, I didn't know that, all those kinds of things. Well, it's easy. And government increasingly is looking at censorship at every level. I mean, we're not, we could talk about that another time, but every piece of legislation, and there's almost a dozen since COVID, coincidentally enough, revolves around some form of censorship. And so that's a problem, when people stop talking for whatever reason. So we can't talk about vaccine injury. okay, we can't talk about this, we can't talk about that. Like all of a sudden you got a society that have no options left. And that's really what I feel this government's heading. They've been doing it a long time, and it started very much so in a big way during COVID, and I think it continues with the kind of legislation they're introducing every day in Parliament.
Those support groups and censorship, a lot of those support groups on platforms like Facebook, and Meta more broadly, they were taking them down. The Biden administration was colluding with social media platforms to censor and suppress anyone who was speaking out, again, contrary to that safe and effective narrative at the time. It seems to me, especially just kind of going back to the mainstream media and some of the framing of their questions, that suppression and that censorship is still very much alive and well, because there seems to be this getting ahead of the Allison inquiry by framing everyone as being these radical conspiracy theorists who took ivermectin and promoted horse dewormer and are just anti-vax fringe people.
Right. And like I said, the crazy thing about it is every single person that's injured actually was not anti-vax because they got vaccinated. The second thing is this notion that, you've got, people from the government, maybe MPs, talking out and saying, well, we're people really injured. It's like, are you kidding me? This was your freaking program. Like, seriously, you introduced the Vaccine Injury Support Program because people were injured. So it's the government that said that. And I think if we could say anything, the numbers are, from Health Canada, I know you know these, almost 60,000 people injured, 11,000 seriously, 3,500 applied to the program, 3,000 accepted, 252 people. Like, if anything, based on the information I'm hearing and talking about, those numbers are far higher.
I can barely move my legs, and my hands now are starting to deteriorate to the point where at times I can't hold utensils.
And then you start looking at what doctors are saying. By the way, we were discouraged, even Dr. Hoff yesterday saying, like, I actually filled out forms because these were my patients. I've been a family doctor for 28 years. I'm dealing with First Nations.
When the vaccine rollout began, I tried to alert my colleagues in the area to serious safety signals and was reprimanded by the authorities and told that I was not allowed to say anything negative about the vaccines.
This is a guy that cares deeply about his patients and about his community, and yet we're gonna gaslight him. Come on! I mean, this is the terrible part of it, is the government actually admits there were injuries because they have a program, and yet in the same breath they can have liberal MPs say, "But we're not sure if that was the case."
Right.
Why would people want to come forward and share their stories? Because they're afraid of getting gaslit.
And dismissed,
right,
and ridiculed. Like the ridicule is so, again, re-traumatizing for people who have already been suffering and debilitating. And then trusted, right? They trusted the government had their best interest at heart. They trusted we're doing our part. We're keeping our communities safe. We're getting everyone out of the lockdowns, out of this endless social isolation, out of these devastating restrictions. We did our part, now we're suffering as a result, and we're just left out to wither away, is essentially what I've been hearing over the last few years. And speaking about Hoff specifically, and the lack of ability to adequately report vaccine injury was something I blew the whistle on in May of 2021 with ER physician in Northern Ontario, Dr. Patrick Phillips. And he had all of his vaccine injury reports completely rejected from the multi-layered, leveled bureaucracy filtering system that's in place to report vaccine injuries. His medical officer of health rejected every single one of them based on technicalities, not necessarily on merit, and information as an ER physician he wouldn't necessarily have access to, but they should have been going back to family docs and whoever the vaccinators were to gather, lot numbers and things like this. My point is that if those things had have been listened to instead of ridiculed, dismissed, censored, and suppressed in 2021, would we even need an Allison inquiry at this point?
I would say probably not. I mean, that's the whole point. If you think about it, we've got 30 countries around the world, OECD, G7 countries, looking at some types of inquiries, right? Around things. And so when you come through any kind of pandemic, would you not think the government would want to look at what they did and figure out how they could do better next time? You know, it's not surprising that pretty much every province and of course the federal government had a pandemic response. I don't think one of them followed, not one of them followed any of it, right? And so that's the challenge. You know, you talk to guys like David Redmond, which I think you guys probably have. He's been very adamant. He said, you know, that's what he did. That's what he did when he was part of our armed forces. Like, when you have a plan, you should look at the plan and try and execute the plan. Or why do you have the plan? So not only did they have a plan and chose not to follow it, but they chose after it was all over not even to maybe look back and figure out there's ways to improve. And once again, if we can't talk about this stuff, well, there's not a chance we can ever approve it, right? My job is to listen to my constituents and help them access government programs. That's what I do. That's part of what I do. And so for even other MPs to gaslight me because I'm doing that, like, come on, like, that's what we do. We do that every day.
Why you and not, say, for instance, Shadow Minister of Health, Dan Masier?
This is something that I've been thinking about for many years. Like, I've been thinking about it for 3 or 4 years. It started when people called my office about having to get vaccinated. They're saying, like, I'm immune compromised, or I've had allergic reactions. And then, I've had people calling, crying on the phone saying, like, I'm in 3rd year of nursing and I have to take this or I can't continue in the program. And I've invested 3 years of my life and I need to have a job, like, all these kinds of things. I'd have a 55, 60-year-old truck driver calling me saying, like, I'm allergic to vaccine. It's true. I can't get an exemption, and yet I'm forced to take that. I'm worried about my health, and I'm worried about possibly having an adverse reaction. So when I heard those stories back then, what's changed? Well, nothing's changed. Now I'm hearing stories of injury. So the people that were reluctant because they knew or they had issues with other medical concerns are, I'm not saying the same people, because there's that and a lot more, have been reaching out to me for a number of years. And so the challenge is always, like, there's so many things going on in Parliament, and I've always felt strongly about that. Then the next thing was, well, when's the right time? If you want to have an inquiry and have a conversation, but no one pays attention, are you wasting your time? And I think it's never bad to talk about these things. So essentially, I'm talking about these things in private, in my office, in a boardroom like this. And I thought, why should we not just talk about these things publicly? Because sure enough, if my constituents are dealing with these issues, and I know for a fact other people are, maybe it's a chance to get everyone together and have some conversations publicly so people realize they're not alone.
The fact that my mom had trouble breathing 10 minutes after the vaccine, went unconscious almost immediately.
People reach out to me endlessly about this topic specifically because there really isn't a lot of coverage, again, in the mainstream. There's basically nil on this topic that's, in a fair and balanced way to approach what happened with these, at the time, still very novel COVID-19 modified RNA shots. Someone sent me just last week, to volunteer at the Guelph Humane Society, you have to show proof of 2 COVID shots. I mean, so the mandates, people say COVID's over, get over it, move on. But there are mandates in certain sectors of society that are still, and healthcare especially.
Hospitals.
They're still very much alive and well.
Most of the hospitals in this province, right? Mm-hmm. So, exactly. And so if we can't have a conversation, we're never going to be able to move the needle on this at all.
And just speaking back on Pfizer specifically and their COVID shot, because Pfizer and Moderna were sort of they were the shots that were used primarily throughout this rollout. And we know that Pfizer has the largest criminal charge in US history for fraud and improper or incorrect, misleading marketing. Do you think that we should blindly trust companies like that to submit their safety and efficacy data? I mean, is there a larger conversation that should be had here about the role of Health Canada and the Public Health Agency of Canada, not only in delivering and administering this vaccine injury support program, which now they've renamed and taken over, but to just blindly trust these mega marketers who made $80 billion off of these shots at face value?
Well, I don't think there should be a blanket immunity. I think any pharma company should be responsible for the products they put out. The fact is that in the first 90 days there was a list of like some 1,287 potential side effects as reported by individuals. That was back in the beginning. Well, the fact that Pfizer wanted to bury that for 75 years, we start asking all these questions. Why would we not then not want to say, is there something we could do? Could we do more to make these companies more accountable? Absolutely.
And I think that's, that goes kind of above and beyond your inquiry, I think.
Well, no, so and that's the challenge, right? Like, should we have a more fulsome inquiry? Absolutely. Do I have the resources or the mandate as an opposition member of parliament to do that? And, one of the questions yesterday at the presser was like, well, you don't have the mandate. You can't, I said, I know, I can't compel, but that should not stop me from doing what I can do. Right? I can meet with people. I can have conversations. I can listen to their stories. I can advocate on their behalf. So should I not ever talk to people because I can't do that? I've been in opposition now for 10 years. I can assure you, government is much better than being in opposition. So the reality is as a member of parliament, you got to do what you do, and you listen and you help. It could be Canadian pension plan. It could be old age security. It could be immigration. This happens to be a portion of the population that has been totally ignored, totally abandoned, and I feel like I wanted to help them tell their story.
And just on the vaccine injury support program specifically, it was through my exclusive investigation and access to information reports that discovered that consultancy firm Auxero, which was actually rebranded from Raymond Shabbat Grant Thornton in sometime 2022, I believe is when they rebranded, but they received 2/3 of the budget allocation.
$55 million
for the program. It also took them
35 of the 50. Yes.
Yeah, it almost took them almost 3 years to actually roll out the program. They weren't ready at all when it was first announced in late 2020, early 2021. And so this was a massive filibuster from the onset. Within the first 6 months, there was flags that this program was going to be way over budget, and they had a massive influx of claimants that they were not prepared to undertake. Just going back now to the Public Health Agency of Canada, taking over that program, taking it back from Auxero, the fact that we've lost millions of dollars to this consultancy firm that basically gets to just ride off into the sunset and laugh all the way to the bank.
Zero accountability.
And the fact that PHAC's now taken over this program and renamed it the Vaccine Impact Assistance Program. What would your message be to that agency or Health Canada in wake of the devastation people are suffering through with zero accountability and still not at all given the fair and timely support and compensation they were promised?
Well, and because of that report, the House of Commons were looking potentially at trying to deal with the Vaccinator Support Program at Health Committee. But there's been a few other scandals around health. So let's give them more money and more opportunity, right? So that was the other reason I thought the timing was right, because we're no longer in a minority government situation. There's not a chance the government is going to want to look at that. And so I think that one of the things that we need to continue to do, it's so important to have independent journalism that can look and do research and access to information. We do order paper questions, and I've done a bunch on this issue as well. But the combination and then trying to raise it, I think things only change. The reason that program changed is because of outside pressure and inside pressure, a combination working well. So the system works, but it works brutally slow. And it doesn't always work. But like I said, if it's going to work, it's a combination of outside accountability, digging research, being tenacious around that stuff, and it's having a few MPs saying, this issue, I'm going to take this issue and I'm going to run with it. I know our report is not going to bring any findings per se, but that doesn't mean I can't stand up with House of Commons and ask questions on what I've heard. And that's what we do. We talk to our constituents, we stand up in the House of Commons, and we ask questions about A, B, or C. So we may not have some kind of formal report, but I can assure you I will continue to ask questions about this in those comments.
Mm-hmm. And hopefully advocate on behalf of
100%, absolutely.
Yeah. Now, I note too that when PHAC was first developing and implementing or outsourcing the program, they wanted to outsource it to a third party over a concern of a perceived conflict of interest. And now, I really question PHAC, who was in control of the authorization and the approval of these same injections. Now, how did that conflict of interest, how is it remedied or dealt with over the last few years for them to now be in a position to appropriately or adequately take over this same program? So I have a lot of concerns there, but
And you should.
Yeah.
Because so do I.
And I think many Canadians should, but
Sure.
again, we just can't even break through that veil to have that discussion.
Well, that, and it's just, you think about how obtuse it, like it's so cloudy, it's so hard to get information. They're not very transparent. Transparency is an issue. And so when you can't get information, it's very hard. It's keeping track of real numbers versus sort of fake numbers, right? It's funny that they had a scoreboard during COVID that they could keep track of everything, but they refused and have done everything in their power to make sure they can't keep track after the fact. My goal is really to give people permission to tell their stories. I don't think they felt they had. My goal is to help the healing. Nothing can be done. People are injured, and they're injured, some are permanently, and we know many have died. But we really, if we could just create a little more awareness, and if people would start to understand that there are people around them, they may not know. And the people may not know because they get labeled all kinds of things. But we need people to be able to have conversations about this stuff and not feel like they're being gaslit.
Will the Allison inquiry hear from any of the unvaccinated, or perhaps people who did not disclose their vaccine status and were financially, economically destroyed by the fact that they refused to submit or they refused to comply with the vaccine mandate and lost their jobs, lost everything, lost their livelihoods as a result of that medical and arguably informed medical decision?
Yeah, no, I think that there's a lot of things we can talk about, like lockdowns. It would be another that would be pretty close to that. Unfortunately, I mean, it's like you said, with 1,000 people, and going to be able to hear just over 50. We'd love to hear more. We tried to keep the focus so narrow. I'd like to see other conversations happen. And you're absolutely correct, because I talked to restaurant owners. I talked to a number of people that, quite frankly, were destroyed financially as a result of lockdowns and policies, whether it was municipal, provincial, or federal at the time. So yeah, there's so many things to cover. It's just like I had to focus on something very narrow that actually are things that I do every day in my office.
And I know that the feedback from certain MPs, and certainly Liberal MPs, has not been promising that any of them will necessarily attend any of these hearings.
Pierre Poilievre and Dean Allison are trying to get out of this is more about grievance politics and less about finding a way to materially improve anything.
Do you have a message for your colleagues or your counterparts ahead of the September 8th start?
Yeah, I think there's obviously from the 50 people, they'll be from all over the country. So the people that were injured will be reaching out to their MPs. We know it's a tough, we know it's a busy time of year, but these stories are pretty important. So I would just encourage any MP from wherever they are across the country to try and make this a priority by, if you get a phone call from either the injured person or from my office saying, hey, someone's been injured in your riding, it would be great if you could come and hear their story. I think that would be fantastic.
Yeah. Well, thank you so much for joining me today, and thanks for your work on this, and I look forward to seeing you in September.
Thank you. I look forward to having you there.
All right. Thanks so much, Dean. And for Rebel News in Cobourg, I'm Tamara Ugolini.